indivisible, with liberty and justice for all. Uh, the first item that we have is if Vice Chair Pauline Perno, if you could do a roll call of the members
Absolutely. So Ralph DeChico, you are.
present.
Pauline Perno is present. Jason Barone.
Present.
Mario Gramanis.
Present.
Ellie Vargas.
Present.
Hi, Ellie. And Anne Marie Fiore.
Present.
Hi, Anne Marie.
So we have everyone is present, so we have a full account of our members tonight. Thank you very much. Item number one, I had sent everyone not only the agenda for this meeting, but also our meeting minutes from our January meeting. Everyone hopefully had a chance to look those over. If anybody had seen any omissions or any errors, please let me know. If not, if you were at that meeting, if I could have someone make a motion to approve.
Motion to approve.
I'll second it.
Okay. Made by. Okay. Okay. Perfect. Okay. Item number 2 on our agenda, we have a guest speaker that graciously is joining us tonight. His name is Jared Craig, even though I incorrectly sent him an email a couple of times because it was a couple of crazy days. I incorrectly addressed the email by Craig, and I sent him another apology. Thanks for Pauline noticing that. He is the mobile operations manager for the MGH community care van. So thank you, Jared. If you want to just introduce yourself, and then I've given you the privileges to share your screen, and you can go ahead with your presentation.
Sounds good. Thank you, Ralph. And I will say I have 3 first names, so my whole life I've been called any order of them, so there's no issue there. But yeah, as Ralph said, I am the operations manager for the Mass General Hospital Community Care Van, which is part of a fleet of 3 vans. So there's the Mass General Hospital Community Care Van, mine. There's also the Brigham Women's Community Care Van and the Salem Hospital Community Care Van. So we try to cover between South and North Shore, all the way up to Salem, all the way down to Mattapan, in that area. I will share this, and please let me know if you guys can see this. Yeah. Okay.
All good.
Awesome. Thank you. So this is kind of a overview of what Mass General Brigham, the enterprise that includes MGH, Brigham Women, Salem Hospital now, the community health and health equity department is rather large. It doesn't just include my van and the van program. We have, of course, the MGB community care vans. Like I said, there's 3. All vans are out between 20 to 24, even more hours a week. I mean, this coming summer, we'll probably be out, 30 hours a week each van. So while it says the 3 vans are out around a little over 60 hours a week, we may this summer be out 90, 100 hours a week. Trying to bring care to those, and this is how I explain it. There is, of course, so the van is free, essentially. It's what we provide in terms of services is free to anyone. You can come with or without health insurance. But our main goal is to really help people bridge the gap from not having a primary care and being engaged in care on a regular basis to having primary care. Of course, I would love to be out of a job because everyone has a primary care physician and they see them on a regular basis and they manage their chronic illnesses, whatever those may be. But that's kind of where we come in. We started during COVID, bringing vaccines and testing for COVID out to communities that weren't, easily accessible or had lower rates of engagement with their primary care physicians. So that included like Chelsea, Revere, they're not as easily accessible with the T and the BTA. So going out to these areas that have had historic issues with getting care and bringing it to them. And so once COVID kind of became more of a endemic situation, like the flu, of course, worse in its own way, we shifted more towards screening. So the MGB community care vans do a lot of screening when it comes to cardiometabolic diseases. So anyone with hypertension, a family history of hypertension, we want to make sure we're on that. Also diabetes. So we check people's glucose levels. We can get them in for A1C levels at a nearby, uh, whatever works for their insurance. Or if they don't have insurance, we can work with them to find a lab that will do it for little to no cost. And we also do, especially with MGH has this program called the Bridge Clinic, where all the vans 2 days a week will do substance use disorder treatment. So that can be things like needle exchange or harm reduction. We could also get, our goal, of course, is to get people into rehab or uh, uh, giving them education on, other resources to help them quit. And then our next part, so the mobile postpartum care unit, they use 2 of the vans once a week for each van, and they enroll 100 individuals who are mothers that are expecting or previously recently gave birth, who are MGB patients. Whereas for the MGB community care vans like mine, you can be a CHA patient, you can be a Beth Israel, you can be anywhere else. We will, it doesn't matter. You don't have to be a Mass General patient to get care. But for the mobile postpartum care unit team, you do have to be an MGB patient, and they'll follow you for a year after giving birth to follow the mother and the baby. It's not supposed to, supersede going to a postpartum care physician or their primary care physician, but it's supposed to supplement it and make sure that they are followed, and advocated for. And the results for that have been really impressive. We also work with the Walgreens in Lynn and Mission Hill. Anyone can come in there. We have a nurse practitioner there that will, do checkups or kind of almost like a physical in a way. Very similar to the community care van, but not on a van, of course. It's in these 2 different Walgreens. And then we built out a clinic with La Colaborativa in Chelsea, within the their La Colaborativa Survival Center, it's right under the US 1 bridge there. But
Not too far from Market Basket.
not too far, exactly, yeah.
Yeah, and the commuter rail is right there too, I believe, right?
Exactly, yeah, it is right
Yeah.
there. They're great, and that way we're able to serve especially our immigrant community and those that maybe don't speak English as a first language. La Colaborativa has been great in serving the community in Chelsea, Revere, Everett, even, it's not just, serving those in Chelsea. It's kind of like a lot of our communities in that area, um, have a shared experience, especially those that just moved to Boston, especially from other countries. This kind of just goes over, like I said, we do blood pressure screening visits, diabetes education and assessment, substance use disorder, like I said. A big program that we started just in October of last year is our colorectal cancer screening program. So we have 2, soon to be 3 colorectal screening navigators whose whole job is to follow people from start to finish. And I'm gonna go ahead here and I'll go back just to show this. But follow people from start to finish. So anyone that comes in to the caravan or one of the 3 caravans or anywhere else that we have a program at, that could be the Walgreens, La Colaborativa. We screen people for, we ask them questions like, does your family have a history of colorectal cancer? Do you have any issues like blood in your stool or things of that nature? Have you ever been told by a physician that you should get a test? Well, the colorectal cancer screening navigator will get them a FIT test. You may have heard of Cologuard. It's very similar to that. Um, and we will send it to the lab. The cost is totally absorbed by our program. Has nothing, will not be something that any patient will have to, burden. And then based on that, if it says we need further testing, that next test would be a colonoscopy. And the colorectal cancer screening navigator will work with the patient to get them into a colonoscopy that, like I said, the community care van has nothing to do with if someone has health insurance or not. Well, even if they don't have health insurance and they need a colonoscopy at that point because the Cologuard test suggests it, we will get them in for a colonoscopy at no cost to them. So this has been something that just started, like I said, in October. So far, results are really promising. We're following people from start to finish, and the whole point of that is to really try to catch these, with any cancer. If you can catch it earlier, the better prognosis, the less cost for the patient long term, all around a better end result for that. But let me back up here. I got ahead of myself, of course, as I do. This kind of goes into that, what I just said. So we really try to follow people that are experiencing hypertension and diabetes, whether it be maybe a future, anyone that's pre-diabetic or, having higher, because hypertension develops over the course of one's life. We also do the substance use disorder intervention. We try to reduce one's harm for themselves or get them into rehab ideally. With cancer, as I mentioned. And we also, a big part, each van has a community health worker who is dedicated to that van and that team. And they are amazing because they work with each patient to get them into primary care if they don't have one, to help them get on mass health if they need it, to get them transportation to a doctor's appointment, anything and everything in between. They are there to, if we just had a nurse practitioner on board and no community health worker, all day long we can order labs, we can say you need to go to the doctor, but if no one's there to help them, listen to what their life involves, and this especially um, pertains to people in our disability community that have a very individualized experience in life. If no one's there to listen to that and try to help match it, I mean that it's only half the issue. So this is kind of some data from last year. So between all the vans, we saw 6,200 people or so over the course of the van program's life. So that's 5 years. We've seen over 40,000 patients, which I always say to people for context, in a normal hour at any given primary care clinic, they'll on average see 2 to 3 patients. The care vans on average in an hour see 4 to 5. So we're really trying to efficiently, but in depth, address people's needs, especially in those areas that I highlighted, and try and get them into coming to see us on a monthly basis, or going to care, of course, is ideal. But we try to ensure that we're seeing people that see diverse communities, of course, people in communities that have had a historic issue of getting access to care. We do a big thing. We of course we, like I said, started with vaccination, but we still try to vaccinate people. It may not be our main focus as it used to be during COVID, but we do a lot of flu vaccinations. This data was right before flu season got into full swing. We've been a lot of flu vaccines since then. And our big, thing is, we also, for people that maybe are without insurance or with insurance and just aren't monitoring their hypertension or diabetes um, regularly, we also give blood pressure cuffs. It kind of shows it at the bottom right here, home BP cuffs provided. We give out blood pressure cuffs to people so they can monitor at home and let us know, hey, this is what I got on average for the month since I last saw you. Or we also give out glucose monitors with the lancet so they can put their finger and the test strips. We try to reduce as often as we can the barrier to monitoring chronic diseases in the meantime while they are in between not having care and having care. And I think the last two slides I had to share was this is fiscal year 25. So that's October 2024 to basically October 2025. These were the areas, especially those in like the darker green and red that we really were involved in. So up on the North Shore, that's the Galen van, Chelsea Revere, that'd be my van, and then down in like Dorchester, Roxbury, Mattapan, that's the Brigham Women's van. And I started with this van in November. The previous operations manager was still kind of a little south of downtown. So I'm trying to bring us, I mean, we are in Revere a lot more now, which I'm really happy to say. I mean, we just got on with the Revere Community School, joining their afternoon classes for people learning English as a second language. We're with the Women Encouraging Empowerment. We're with several places for the Revere Housing Authority. So we recognize that Revere and Everett and Chelsea is where, our van can really do some good. And so the next slide shows whereas the previous one shows where the van's been in the last year, this shows where the people that have come to the van are from in terms of zip code. So it's uplifting to see that, like, in general, comparing the two, we're serving people that are in those areas that we're going to. They're not coming, from Brookline or Melrose or other areas that maybe don't need the care as much because they're generally more affluent or things of that nature. They're more engaged in care in those areas. So we really want to do a good job of looking at. We do community needs assessments all the time, and we want to look at, hey, we want to meet the people where they're at. And this is going in the right direction of where we want to go. But that is kind of the gist of the whole program. Dr. Priya is our medical director. Her information's there if anyone ever needs to get in contact with her. But I hope that gave you guys a good overview. And if you have any questions,
Yeah, I have just a couple of questions. Thank you, Jason.
Hmm.
How accessible are these medical care vans for people with disabilities?
That is a great point and something I think of often, especially now in the snow. I see these narrow walkways to get to places, and I just think, how would someone, especially those that are in a wheelchair with crutches or what have you, get around for this, during these times of the month. So while I say we're on a van,
You have the tents on the outside.
the what?
You have tents on the outside. You set up on the
Well,
outside of the van.
during the summer, yeah, for sure. But during the winter, while we are bringing all the supplies and our team, of course, on the van to these community-based organizations that we're going to, like Women Encouraging Empowerment or Revere Community School, for example, we're going off the van in the winter months mostly and going inside to lobbies to these
Okay.
places. Or if they have, of course, a private room, that's even better. Just because it's while the van has heat and everything, it's hard to access, and the van doesn't have a lift, and we recognize that, so it is easier. And even in the summer when we're, say we're on the van at a park or something, we'll bring the team off if we have someone. We've had that happen before, where we have people come up and they're, in a wheelchair. They maybe they're unable to climb the steps. We'll come off. We'll bring everything off. It's no issue to us. We want to make, that's the whole point of this. We want to make it as easy as possible, because someone wouldn't be coming to see the van and get care if they could go to a brick and mortar clinic, in the first place. And we recognize that. So yeah, I hope that answers that question.
The other follow-up question I have is, I see you keep some data on demographics. Do you keep any demographic data on people that you see that have disabilities, mobility issues? Do you keep any of that data?
Um, I don't, so in a way, yes. So we check people in on Epic, just to adhere to like, uh, electronic health record standards, make sure everything's safe. And, on Epic, we have the secure browser and everything's, it's just easier to do on an Epic and make sure everything is secure. So on Epic, when you check people in, at least for Mass General Hospital, it'll ask if we need to update their disability accommodations, and it asks a slew of different questions as to if anyone identifies with a disability. Um, and so we can pull that data in, say I wanted to see who's coming to the van based, and if the people coming to the van had a disability, I can pull that for any other given month in the past. Um, so we always do update that.
Mhm.
I don't think it's something that since November that I've seen the leadership like say, oh, let's look at that. And that's something I think that's a great idea to look at. Like, are we really reaching people that maybe identify with having a disability? And are we
I know if
serving
you're
everything?
starting to go at like the Revere Housing Authorities or housing authorities, a lot of the senior buildings, there's a lot of residents in there that may not have access. Like you're saying, you're trying to reach the demographics of residents that cannot get to medical facilities, and the care van is going there. It'd be great to see how much this increases people with mobility issues. That cannot get to there, how valuable this is for them, especially in the senior center, not the senior recreational centers, but the senior buildings
Yeah,
of that
yeah,
nation. When you're off the Shirley Ave neighborhood, you got Walnut Ave and a couple of those buildings that you're saying you're trying to go into the housing authorities. So we have a lot of those buildings, and there's a lot of not only seniors, there's a lot of residents with disabilities who are homebound that stay in their building, that this benefits. That's why I wanted to see the accessibility. And I'm great to hear that you try and go into the buildings where there's a room, especially in the wintertime. But I was just curious to see if there was any demographics on that. And I'm assuming that because I was involved with the food pantries in the past in Riviera, and at that time, MGH, these vans, they were using them to come and get the boxes of food and helping to distribute those. So I know that they were involved with the Department of Public Health in the city, and I think you're still involved with the Riviera Department of Public Health um, agency.
yeah.
Do
I
you
did have a meeting the other day with, I
with
think
Lauren?
you guys may know Lauren and them.
Lauren, yep, Lauren, yep,
Yeah. And
yep.
so I also know MGH has expanded maybe with the food. Since then, they now
Right.
partner with the YMCA to do the mobile markets, which is another mobile situation where they bring food to different parts of the community, that, you know, allows for maybe more accessibility than having to go to a specific site, especially because I know a lot of the um, food banks across Greater Boston have, lines that, down the street sometimes, or they have wait lists even. So, because they're all trying to serve families in need, of course. So that's something new that I know that we're really trying to expand that partnerships with the YMCA.
I
We
heard that they're supposed to be doing it on like Monday or Tuesday from like 12 to 2 near Shirley Ave with the mobile. Is that correct or is that incorrect? I just heard that from that recently from someone
um,
else.
that's a good question. So another
Anyways, I had a backup question. When can we get all this lovely information? Like, if you had like a scheduling, do you have like a site or something? If you want, like, wanted
Right.
to show up to one of your sites to get like a checkup or whatever the case may be. Because I'm local, I'm next to the Revere Beach station, not even 5-10 minutes away. So if I was like
Mm.
needed somehow, how could we find you? That's my question.
Yeah,
For
I'll
everyone.
share. So we do have our website um on Google, and it has our mobile van schedule, which we update, for the web, however often, on a monthly basis, essentially. So let me put that in the chat.
No, I mean for people that are not in chat, just
Oh, if they're not, so
yeah.
for so we go to like to Ralph's point, we go to like Liston and Hyman Towers. We go to, like I said, Revere Community School. I
Mm.
create flyers in multiple languages and send them to those community-based partners on a regular basis. And now with the Revere Department of Public Health and Lauren and her team, we're also starting to share anyone that we're any partner that we're going to in Revere, we're going to share all those flyers with them so they can post it and let people know. Because I know sometimes it's really hard to find, you know, where anything's going to be, even in a, especially if you're looking across Greater Boston, but even in Revere, like there's a lot of things going on at any given day. So
Has
yeah, those flyers are at the sites, and we're gonna have them with the Department of Public Health. But other than that, we do have our, you know, community caravan website that has our schedule, but it can be a little difficult. I do recognize that. Yeah.
has there been any logistics talk on how Lauren is going to be uh, dispersing that information? Is it going to go on the city calendar? Is it going to just be on the DPH, the Department of Public Health page? Are you just in preliminary talks with them?
Yeah, are you guys gonna do it for like 311 just for in case if they want like someone nerdy like it hit up 331? Do they have that information? That's all good stuff.
No, that's a great point. I will reach out to Lauren and see. I didn't know what contact she was going to go through to get that out through at least the Department of Public Health. And if they can put it on the city website, I mean that's even better because it's something that is a little more accessible. And 311 is a great option. So I will raise that to her because I think that's a great idea. It allows it to be, you know.
This is because Ellie, there's the weekly newsletter that goes out, and they may be able to put that in the weekly newsletter where it's going to be each week or something like that. But I don't want to speak for them, so I don't know what their plan is on how they're going to um, pass on that information.
No, it does not hurt to ask at all. Yeah, for sure.
Mhm. I live at the Hyman Towers. Do you and I see somebody once a week. They come to do the blood pressures and check people's vitals. Does that have anything to do with you guys? Is that
Yes,
like I don't
that
know if
we do go
that's
to
true.
Hyman and we do go to
Okay.
Liston. Yeah,
Yeah, I
that's
see them once a week. Yeah. Okay.
well, we aren't there once a week. We're there once a month. That may be the
It's
Department
probably
of
once
Public
a
Health
month. Yeah.
that
That's probably
comes.
Department of Public Health, Mario.
Yeah.
Oh, okay. Yeah, because I do. Because I was wondering what that that was from.
Yeah, that's probably the Revere Department of Public Health.
And the blood pressure checks are great that they do because, it's important to check that on a regular basis, but we can offer a little bit more with, glucose,
Mhm.
vaccines, ordering, we can even, we have often people come to us and say, hey, I'm on, any sort of hypertension med or,
Mm.
big things. And they're like, I haven't seen my doctor in 3 months and I'm about to run out. Our nurse
Mm.
practitioner can order a month of that med.
Mm.
And help get people to the next point. So that's a
The,
big thing that we also do. I didn't mention.
the other question on on the caravan, what is your bandwidth for languages? Do you use
So
service or call-in service or
we on the van we're bilingual in Spanish and English in person, and then we use the language line through
okay,
Mass General Hospital. And
okay,
but even when we, for example, go to Hyman, we have every time like 4 or 5 ladies that come in a group, and they all speak Moroccan Arabic, and we've never
Mm.
had an issue with using the language line with them. That it
oh,
works pretty well.
Oh.
no, I just wanted to get that out so people know that you do, you have to use the language line for interpreting
Yeah,
for
for sure.
perfect.
Any other
Any other
questions?
members have any other questions?
Yeah, I'll say, well, more of my suggestion would be that I would honestly tell you that uh, you would think that Brookline and places like that would not have a need for it. But honestly, to tell you the truth, there's a huge immigrant population, a lot of other places like that, and also folks that are elderly that or disabled that need that assistance. So it might be something they want to look at because they may not be able to get into a place or don't have anybody anymore or places that they can access easily who have chronic conditions. So it's just something they might want to look at for MGH because
Mhm.
it's getting more and more difficult to get to care. And someone like myself who's disabled and have a chronic health condition, I'm finding that with the visiting nurse type stuff as well. So it's getting more and more complicated, you know, and as the diabetes side of things make things more of a mess. So it would be helpful, just something that they might want to look at as a team instead of just assuming because some area is wealthy that those people don't need it. You don't know who's living there. That's just a suggestion I would look at, you know, going forward because
That's a great point. Yeah. And
because
this is not based on anything of assumption. We do,
yeah,
community assessments on like a quarterly basis where we send our community, not the community health workers that are on the van, but we have a core of community health workers that go out and talk with communities around Greater Boston. That includes Brookline out to Brighton, Alston, Melrose, and Somerville, everyone, in the area. And we really try to see where the greatest need is. And
yeah,
while there can be pockets, of course, in communities, of, maybe perceived affluence, we have to, really sit down and think the van can only be in so many places in a given month. I mean, right now the van
yeah,
does 2 clinics a day. So
yeah.
and it can be all over Boston each day. We have to think, where can we do the most good? And that's a great point. And the other day I was driving past the Brookline Senior Center, and I thought that very idea, that's a great place to talk to.
Well,
Um,
because there's a lot of places here that they have a nurse, let's say, a nurse at some of the retirement communities, but they can't do certain things, and it's a lot more pressure. They're limited in what they can do. So, it would be helpful because when you're running into more complex issues like myself, now I'm going to need a patch or a pump. It is hard to get visiting nurse services through the long term, let's say, like long term ones. So options would be helpful because then I could maybe do care where now I got to rethink those things or medication I might be getting that I can't afford, those kind of things. So it would help to have access to that and take some pressure off some of the other side of it because, one building might have a good example, say 200 people living in it. That nurse might only, can't do everything, but also by their licensure, they can't either. So
that's
it would
true.
be just something to look at, my suggestion, because there's a lot more than you would think. It probably doesn't show up, but it's, I'm learning more and more as I get into the healthcare side of it for myself, but I've been part of it my entire life. My dad was a transplant patient, so I look at everything. So it's something I would definitely look at, and I'd be happy to chat with somebody from that program as more about something like that to
Yeah,
try to show
I
that.
definitely appreciate that. And moving forward, I'll definitely keep in contact with about that.
I appreciate it.
Yeah.
Any other members?
No, I just want to say that I remember passing a community caravan and wondering what it was all about. And it wasn't until my daughter was hired to go on the community caravan that I actually understood it better. And I think in the scope of things that, and having worked as a public health nurse, having worked as a home care nurse, and having worked in hospitals, so taking all of that into consideration, there are a number of different services that are out there for people. It's getting that information to the people who need it is, I think, the biggest gap. And I've just, I see the number of hours, patient hours, work hours that are put into finding where the gaps are, finding where the holes are, finding where that they can get more information. And I think maybe for the community care program, the van program, maybe they need to look at having conversations with, as you said, I know, Jared, you're doing talking with Lauren Buck, but the different public health nurses. I worked in Newton and I was a public health nurse who went into people's homes. Very, very limited, as pointed out, Jason. But in the scope of things, there, I think there's going to be an awful lot of overlap of services, which is good. But I think that someone really needs to take the ball and kind of identify different areas, different pockets, what's available to people, and how that information, most importantly, is getting out. I had no idea this even existed until I passed a van. And I have more of an idea now that my daughter is working on one, and that I've had the pleasure of meeting Jared up close and personal. And I think you're a wonderful extension of Mass General Brigham's van. I think that you are the perfect fit for this. And I wish you all the best. I know that you're new doing this, but you're doing a tremendous job.
Well, thank you. And I was gonna say earlier, Pauline's daughter Lily is our community health worker. She is absolutely amazing. And to your point, I moved to Boston in November. I managed a mobile health program similar to this and for the University of Florida. That's
Why
what
would you move up here?
that is what everyone keeps telling me.
Because
I'm
he loves
learning that
no, that's why.
You love snow, and you got it this year.
I did. But I've done nonprofit public health work for several years now. And I think to Pauline's point, a lot of times it is the people that work on the ground, you know, as a home health nurse or a public health nurse that know things that maybe people that are doing programmatic work like myself or other programs across Boston. You know, I see CHA driving around in a van sometimes. I see there's programs all the time, and they don't talk to each other. They don't talk to the home health nurses. They don't talk to the public health nurses. Everyone's kind of siloed in their own areas. And it's an issue. I mean, that is an issue that I hope to God does not affect us forever, because if everyone talked a little like we are all right now, I'm learning things, you know, I'm able to discuss things with you guys, and I think it's great. But it is a matter of trying to tread water in terms of getting information out. You know, Lily does that every day as our community health worker, and she's amazing. She teaches me things all the time that I didn't
Teaches
know.
me things every moment.
She does, yeah. But and same to you, to everyone here. I mean, I'm learning things that I didn't know before, and I think it's just that's the whole, you know,
Well,
gist is we try
Yeah.
to
Well, we
get better.
appreciate what you do, but I mean, I understand, and I appreciate what you brought up, Pauline, and she's right about that the connection, not talking to each other. But the other part that isn't brought out, a good example, part of the problem is the health insurance and the services that are available. So, an example, my health insurance has like 15 or 30 different VNAs they work with. Okay, so they call all of them, and you call them, and then they say, well, we can't do long term, or the one that could, well, we don't have enough people, so we're not able to do that.
Right.
Then you go to call ones that are
Hour.
specifically designed to do that. So for example, say Caring Bees, or there's another one out there, I can't think of it off the top of my head, but we'll turn around and then say, but we don't take that health insurance, say the main one that I have. So then Medicare and Mass Health is accepted by those, like say Caring Bees. So now the person's got to decide. Do you see where I'm going with that? That
Yeah.
there's a real problem, and the person that's getting, and I mean this respectfully, professionally, is that it's hurt out of it is the patient that is disabled or elderly that has a chronic health condition is not getting the services they need. And then people expect, well, then the family member now has to take in those medical things. And that's not, to me, especially when you're getting into pumps or patches that puncture the skin, where the risk of infection goes up, as Pauline knows, by quite a bit. And so it's not fair to dump that on the family members, and that family member might be working full time, as an example, or so I'm just it would help, because then we can maybe fix some of that, and maybe to get people to realize that a person might have 2 or 3 insurances and they're going to get covered. You just got to do it a certain way. And it's all about this. It's like almost like a bubble for the patient. And it's not really fair, because the patient is the one taking the hit,
Right.
And the community too, because then they go up and they go to the emergency department instead of, which I hate, by the way, as Pauline knows.
Mm-hmm.
I don't want to go.
Don't
That's my thought. Especially when they're overridden like this, but I still don't like to go, period. And it's just frightening,
Yeah.
because it's
It is, and it's very, very very disheartening as a healthcare professional. I mean, yes, I'm retired, but I still worked a lot of years. To have to say the state of healthcare and accessing and making sure that you get what you need is just, it's absolutely horrific. And I've experienced it myself. I'm still experiencing it. It's over and over again. And it doesn't matter how much knowledge you have. It's you need to look at every avenue. You need to have someone helping you. And the van does have what Lily does, and I applaud her every day because she's got every avenue, she's got every niche, she got everything covered, and I admire that. And so, but we need 1,000 of them. We need 1,000 Lilies. I only have one for you. I'm sorry. You can't have it. Fine.
Well, especially with insulin now, because people are, as I'm finding out on Facebook, is that they are rationing this.
Yes.
Pauline, it is, as I told Ralph before we started, what I'm running into.
Get back to the whole thing is the more communication that we can have between agencies and interagencies and intra-agencies. I think that will, it's not going to be an overnight thing. It is going to take time, and it will take a lot of time, a lot of energy, and a lot of effort, and a lot of having the right people in the right places doing the right thing to get us there. So I think that it can happen. And the only other thing I was going to mention is, one other agency here in Revere that might benefit from getting this information is the senior center.
Right.
Because
that's why I said I don't know how Lauren with the outreach is going to be. What the plan getting the outreach there. That's why, especially the newsletter, the calendar. So
getting it as many places as you can. But I applaud the work that's being done because Lord knows it needs to be done.
And I can reach out to them. Do you guys have a contact you specifically know in mind?
At the senior center?
Yeah.
Yeah. Debbie Pesca is the director.
Yeah.
Okay.
Debbie DiGiulio Pesca is the director there at the senior center. But I think that the right thing is you're contacting Lauren, so Lauren's going to know, how to
finger thing going on. She's got this person, this person.
Right. Yeah. You're contacted the right person, and it's just a matter of how they're gonna be disseminating that within the community and the different departments. How they're gonna want to do that.
But now we know that that's going to happen. We can be on the lookout for it as well. And if we're not seeing it, then again, communication is the key.
And I'll reach out to Lauren tomorrow, and if it helps, with at least all the amazing work that you guys are doing on a monthly basis, I can send you the dates and times and where we're going to be in Revere. So if
I can also put that in our monthly.
Yep.
The month, because we meet the second Tuesday of the month, and I can make that part of my agenda.
That would be cool.
Yep. That would be excellent. And Jared, one last thing is, what day are you guys going to be at Revere High School? I saw that you're having a nice 3 to 6 on. Yes. What day is that?
It is starting the 24th of February, and we'll start attending I think that's what, the fourth Tuesday of every month moving forward.
Yeah, I think so.
And it may expand to two days a month, but just because we just started with them, we'll start with 1 day a month.
Nice. Well, I wish you guys all the success because I think it's going to draw a really diverse crowd. I'm hoping. I'm hoping.
Yeah. Oh, sorry,
Ralph.
Ralph.
No, go ahead.
I was going to say, we spent a lot of time with La Collaborativa on, I think, this before I got on, but at a bi-weekly basis. And so we just offloaded that because I showed you all that we built that clinic out there in partnership with them. And so they kind of have their own access to our screening services now there. And so I think that we have the capacity now, and we have, of course, the skill set with our bilingual staff to really, I think Revere Community School could be great, especially because as Fatu
Yeah,
mentioned to us, is it's a lot of especially new neighbors to the Revere community from different parts of the world, especially our Latin American countries. So anything we can do to help them with getting screened, especially before they get into care, or a lot of people come to us with vaccines they need for immigration. We try to really do that.
Excellent.
right. Well,
Amazing.
thank you again, Jared. I really appreciate this.
Yeah, thank you all for
Thank
inviting
you
me.
for all that you do.
Thank
Thank
you,
you.
Jared. I owe you.
Thank you.
No, no,
Thank
no,
you.
no, no.
Thanks.
And
For the
anytime
rest
you
of your night.
need any more information, please let me know, and I'll start sending that our schedule for Revere on a monthly basis.
All right. Thank you.
That's
Thank you.
great.
Appreciate it. Have a great night.
You all too.
Thank you.
Okay. Moving on to item number 3 is updates and next steps from the January 13th meeting. It's just updates from Pauline and Anne Marie regarding any future calendar guest speakers for monthly guest speakers. So hopefully we'll have something for March,
I'm
April,
hoping.
and
I'm
May.
striking out with Cataldo, but I'm going to have my son. He doesn't get an awful lot of information on the weekends because it's again skeleton crew.
Can my contact number reach
No,
Hannah?
no,
He's no longer there.
no. So I'm going to go a different route. I'll have Anthony tap in and see if he can find out who I'm going to talk to. So
Yeah, because
hopefully
that
that
would be
will go good.
great if we could get them to talk about what we
Yeah.
talked a few months ago.
Yeah. The other thing I was thinking of trying to tap into is the mental health response team through the police department to see if they would be willing to come and do a little blurby
Okay.
blurb for us.
Okay.
So I'll also reach out to them and see if I can get anything going on that. But when I saw that the community care van was coming to the Revere schools, I was like, oh, we got to have this in here. And I'm glad we did. That was a lot of good information and a lot of good insight.
Agreed.
Okay. Um, yeah, and then, like I said, commission members, if you know of any agencies or anyone that would be great to come as a guest speaker, reach out to Pauline and Anne Marie, give them that information. Excuse me. And excuse me.
Bless you.
Bless you.
Thank you. Sorry about that. So that we want to try and get a few months scheduled in advance so we don't have to try and go month to month waiting to try and get somebody. Makes it a lot easier if we can schedule a few months in advance.
Mm.
Next update is from Ellie. If there's any update yet on reaching Representative Turco's office.
About last week, I went to the hospital. I got hospitalized for low blood pressure, and during that time, I called him personally because I had his phone number. So I tapped to him. I told him about it, and I sent him an email. I'm gonna contact him tomorrow because I haven't heard anything since last week. And
Okay.
also, when I sent the email, I mentioned to him if he had any free time this month or next month, hit up Pauline for setting up something
I'd
so
love
we could have him as a
and,
guest speaker. Sorry, go
and
ahead, Carly.
no, I'd love him for him. That was a great idea for him to come and actually, hear the concerns up front and personal and just be able to address some of this stuff to see if we can get the ball rolling in one matter, shape, or form, because there's more and more people that are now jumping out into traffic because again we're dealing with the snowbanks. But on top of that, it's going to become another issue because I know we're sitting here freezing, but in 3 months from now we're going to be sitting here sweating and we're going to be up against the same issues. It's never going.
Yeah, different elements, same problem, same
Thank you.
situation. Let's find what is it? Solve the issues, not make more problems. I
Yeah,
guess you, Pauline.
you
Totally.
you hit it. You hit it perfect. Thank
Okay.
you.
All right. I'm going to move to item number 4. I'm going to go, since we're running behind in the meeting, I'm going to try and go as quick as I can. As you've seen, they weren't ready in time for the posting, but I do have them. Basically, at the item number 4 is the Dakota Commission on Disabilities Alliance monthly meeting, which was on February 4th. The Somerville COD member mentioned that they are looking for new members. This was a a recurring theme with a lot of commissions. The Sandwich COD member spoke about issues with the accessible voting machines, along with the fact that their commission is also looking for new members. And then the Arlington COD member mentioned that they're having some issues recruiting new commission members. And the Boston Commission mentioned that their meeting last month, they had a presentation regarding snow removal, and at their meeting this month in February, they're going to be having a presentation by their DPW on curb cuts. And the Gardner COD member discussed issues with her town not having a transition plan. And Newburyport COD member is looking to revamp their town's snow removal process. So those were the notes from that monthly COD member. I'm going to move into item number 5 that I wrote in here. I submitted a grant application to the Better Beach Save the Harbor, Save the Bay again this year. And I'm hoping to get awarded again. And this is going to be if we are awarded, it's going to be used towards the 3rd annual All Abilities Day Out at Revere Beach. So I submitted that at the timely fashion that it needed to be submitted. I don't know if I'm going to be made aware in March. Once I'm made aware of it, then the next step of the process is that I have to apply for DCR permits. And I will keep everybody up to date on that. Regardless, I'm hoping that we do get the grant again, and then we can plan for the 3rd annual All Abilities Day Out at Revere Beach, which will probably be again the first or the second Saturday in August, and we'll try and do it even better than last year. And one thing that I'm going to ask for this year is that if we can have all our commission members there. And I'll try and get all the logistics of everything done. But I am going to need a lot of help. And we're going to need to do some talking on the figuring out how to register people a little bit easier than we have in the past. There was a lot of thanks for the Revere Recreation Center with their using their process of people registering. But a lot of people were having a lot of issues on how to go to the recreation site on how to register for events. So when it comes to that, and within the next few meetings, we can talk about how we want to do that. I don't know if we want to just have them send us emails because sometimes things get lost in the shuffle if we do it that way, or leave messages, things will get lost in the shuffle. So keep that in the back of your mind on any other types of ways that we can have people register for an event if we don't want to take up time or bandwidth from the Revere Recreation Center.
Right.
So
Maybe we should also have the community care van come for that event.
yeah,
That makes sense.
Yeah.
yeah, we could see if they're available for that. So put that down at
Good.
somebody keep that in mind. Keep that as a an idea for possible partners for the All Abilities Day Out at Revere Beach. Next is item number 6. I just wanted to a discussion on reaching out to the Revere Public Library to see about what we could assist with purchasing for them regarding books or in-house equipment specifically tailored for people with disabilities. We'd be able to allocate funds from the 22G that we collect for the handicap funds, as long as it's geared towards people with disabilities. I had a preliminary discussion with a person that is involved with the Revere Public Libraries, Friends of Revere Public Libraries, and I believe she is part of the Board of Trustees. And I said that I would bring this up with the commission so that possibly, and then this person is going to go back to the trustees to see what they have for books for people with disabilities, children with disabilities, like books for children to read so they can be a little bit more educated and learn. There's a lot of books out there to see what we can purchase for them. If there's any type of equipment that they need in the library, that's affordable or things like that. So I just wanted to see if there's an appetite for me to keep further pursuing that and what your thoughts are on that.
I think it's a great idea
Okay.
and
Agreed.
probably a necessity, definitely.
Yeah, and I have to, and to elaborate a little bit more on that, I also need to sit down with the administration and see what we can help fund for any accessible projects within the community, such as municipal buildings or anything like that. So I will talk to the appropriate people on that. Um, Next was item number 7 with the Massachusetts Architectural Access Board, the MAAB for variances. We didn't receive any since our last meeting, so I don't have any updates on that. Item number 8 is commission members' late informational items, and I know Jason briefly mentioned that he wanted to talk about snow issues, but I'm going to try and surmise it since we're running late, and I just wanted to let people know that here in the city of Revere, we do have on the books an ordinance for snow removal that businesses and homeowners are responsible to remove the snow on the sidewalks within a timely fashion. If not, they will be fined. If you see that a sidewalk is not shoveled in front of a business or a home, you can report it to 311, and inspectional services will enforce it. Inspectional services does enforce it. I know we've gotten an astronomical amount of snow in that short period of time. But I believe they have been up to date on it. From what I did have a conversation with 311, and they did receive a lot of calls. And inspectional services was going out and enforcing it. But when you do call, you need to have the physical address. You can't just say the street or where it is or a neighborhood. You really have to give them the exact address in order.
Yeah, the coordinates, the GPS. Question: how much is the fine if they find the person guilty?
Uh, I I don't want to talk on that because I don't know the exact fine.
Amount? Okay.
Yeah,
Okay.
I don't know the exact amount.
Okay.
That's something that you could ask 311 or inspectional services. I don't know
Okay.
him, Marie, if your husband does that part of ISD, is he in part
Uh,
of that enforcement on the snow or?
I can ask. I honestly am not certain, but I can check with him to
Yeah,
find out if he knows anything.
yeah. But I know they are doing a great job on that. We just had that not this last storm, that other storm was a lot of snow in a short period of time. All I can say is, luckily it was not that heavy, wet snow, and it was the light stuff. And I'm doing a dance that we don't get any snow tonight, and I'm doing a dance that we don't
okay.
get any snow on the weekend. So, but just to let you know, there is under the Massachusetts Architectural Access Board, um, 521 CMR. There is the responsibility to maintain the sidewalks and clear path. There are, believe it or not, cities and towns that don't have ordinances on the books. Luckily, Revere, we do have the ordinances and we do enforce them, but there are communities that don't. I can tell you that firsthand from other duties and responsibilities that I have outside of Revere, of calls that I've had to take. But yeah, so that's where we are on that. The city of Revere is responsible to clear the sidewalks in front of municipal buildings and schools and municipal parks and things like that. And they've been doing a great job. They were going straight out for those last storms. If you take a look at it, there's a lot of properties that they do. The Revere TPW is involved in doing a lot of the school parking lots, a lot of the sidewalks, and there are a lot of municipal buildings that they have to handle. So it can't get done at the blink of an eye, but it does eventually get done. And there is, as you saw, there was not a lot of places to put the snow. And so they did the best that they can, like everybody else, every homeowner and business owner. We get through it. We haven't had to do this for many years, and we forgot how bad it can get.
Mm.
We got slapped in the face as a reminder this year, and hopefully we won't get it again.
Well,
So
hopefully not. I mean, the problem is, Ralph, it's not just that, it's that people don't, a lot of times don't do the ramp accesses for the cutouts, the curb cutouts and stuff. I'm sure Ellie's run into that too. So
That-
Time for
yeah,
time.
yeah,
That's 3-1. That's why I just said 311, and you have to give them the address. You
yeah.
can't cry wolf unless you know where the wolf is.
And
So if you have to complain about something or you have
Yeah.
an issue with something, you have to tell them where the issue is.
Yep.
Agreed.
That's the only way something will get done. You can't just say this is not getting done, that's not getting done. That doesn't help you, that doesn't help your municipality, that doesn't help the administration. You have to let them know specifically where the issues are so they know where it is so that they can resolve it. There's a lot of curb cuts, there's a lot of sidewalks, there's a lot of areas in the city. So they need to be aware of where it is so they can take care of it. Without them being told specifically where it is. They can't just be driving around. Somebody says, oh, the curb cuts are not clean. They can't drive around the city looking for what curb cuts are not done. If they're specifically told, then they'll be able to get there and clean them out. Hopefully that helps.
Yeah.
And a lot of people, there are a lot of great people, residents in this area that live on a corner that will clean them out, but it's curb cuts, really they don't have to. It's great when they do, but they don't have to. It helps out everybody when they do. Like I say, the person with the disability is the only club, I call it the club, that you don't ask to be put in. When you don't ask to be put in and you don't join. And someday, most people are going to be in that club.
You're right.
Yep.
True.
So everybody try and do their share. It helps out not only a person with a disability, it helps out your municipality. Same thing with fire hydrants.
Yep.
The firefighters can't get out and do all the fire hydrants. So if you live by a fire hydrant, help out a firefighter, help out the fire department, and clean it out for them. Okay, that's my
Your spiel for
public
tonight.
my spiel and my public address announcement for
There
the
Nicely done.
Item number 9, there are no other resident concerns or issues that I received. Like I said, the meeting was running late, so I wanted to try and get through this as quick as possible. The next steps is we're going to wait to hear back from Ellie, for Representative Turco, and also from Ellie and Pauline on any calendar, any guest speakers for any upcoming monthly meetings. And item 11 is the monthly reminder. If Pauline, if you could graciously read that for me, I'd graciously appreciate it.
Absolutely. The Commission on Disabilities office number is 781-286-8267. Residents can also call Revere 311 directly and speak to their staff Monday through Friday. They will answer most questions, but if they are unable to assist you, or if you would prefer to talk with the Commission directly, please ask to be transferred to the Commission on Disability direct number. Please leave us a detailed message and we will respond to you shortly. As always, please don't hesitate to contact us if you would like to discuss or add something to our monthly meeting agenda. You can also let us know if you want to discuss any concerns. The Commission is here to help and assist all residents with disabilities and their families in Revere.
Okay. Item number 11 is meeting adjournment. If I could have a motion to adjourn.
Motion to
Motion.
adjourn. Oh.
seconded.
That was the same time. Wait a minute.
Seconded.
All right, Jason first and Mario second. You guys, will you guys have a button to push at the same time?
Yeah.
Our next meeting via Zoom is going to be on Tuesday, March 10th. I just wanted to wish everyone a happy Valentine's Day. This Saturday, February 14th. I always have to remember this date, not only for Valentine's Day, for my wife, but also it's my mom's birthday. She was born on Valentine's Day, so I want to wish my mom a happy, healthy, success, and many more birthdays. So everyone,
Well,
happy Valentine's Day. Thank you again for a well-attended full meeting tonight. I'm very happy that we were all here, and please be safe. And please, let's have only one more week of winter and summer. Please come, please come.
I
Okay.
agree. It should go.
Yes.
Have a great night.
good night.
Good night.
Bye, all.
Bye. Good night.